Greetings, everyone. New episode of WEDLocked and Loaded. I am Daniel Laurent.
And I am Leah Nicole.
And we have a very special guest this evening. And we want to always inform the listeners of the different resources, procedures, conversations. And we just want to always inform the audience because I think it's important. And it's things that people don't know. And, you know, we want to be a vessel and a conduit. Conduit.
Okay.
Yeah.
I think we got it.
All right. So we are fortunate enough to have Lana Kerr, who is the founder of Lumisque, and the signature procedure is CO2 Lift, right?
Mm-hmm. That's our brand. Yes.
That's the brand. Mm-hmm. And so as people are listening, because I felt this way when I first heard the name and I had to like dig in a little bit, can you explain?
Go ahead.
She's being fresh. Can you explain, before we get into what it is, can you just tell us a little bit about yourself and what got you to the point of wanting to create a brand that was going to improve women's health, essentially?
Okay, well, thank you for inviting me to your audience, to your show. It's good to be here, and I love talking about this. Just to give you a little bit of background, my educational background is actually in finance and accounting. So I used to work with KPMG, and then I worked in investment banking. But then went back to school, studied nutrition, and then opened a series of weight loss clinics. Once people got to losing weight, and we've helped over 30,000 people through our programs, we found that people started wanting to take better care of themselves, their skin. So we opened a spa and looking for products that were just as unique and as efficient as our weight loss system. That's what got us on the search for what could be this big thing. And we came upon carboxytherapy. And I know I'll get into what that is, but that's how we got into the CO2 lift. So I'll back up. Carboxytherapy is the therapeutic use of carbon dioxide gas to regenerate the tissue. It's very effective in doing that. It has a very long history. People would start in hot springs with carbon dioxide back in Japan. They would find that it would heal the wounds of the samurai warriors very quickly. Then fast forward, the French developed an injectable version where you use a tank of CO2 gas, you put it to the skin. And then fast forward to 2015, the Japanese developed a gel delivery system. By mixing two gels, you create CO2 gas. And we have the exclusive license to that technology.
Wow. Okay. Mm-hmm. Now, So let's say Leah is very intrigued and she loves this idea, right? What would be the process for Leah herself to find you, make an appointment? What does that look like? I'm assuming there's a consultation, right? Do you kind of see if she's a good candidate or is it for everyone? Like, how does that work essentially?
Okay, so first of all, this is not just for Leah. You too, Danielle, benefit from this.
No way.
Yeah, because it's for skin in general, and we don't have a clinic anymore. So our weight loss clinics, we closed down. We eventually went virtual, and someone else runs that now. So this really is a set of treatments that are sold to dermatologists, plastic surgeons, gynecologists, hormone clinics. So it's a treatment that is sold. And people can go to their doctor and get it depending on what they're looking to achieve, as well as we have another version available online through our store. So carboxy, when we started first, it's for skin. We started with dermatologists. If you want to regenerate your skin, anti-aging, one of the biggest things that causes aging is our skin gets thinner and we lose the ability to hold water. So the CO2 lift, when you put CO2 gas into the skin, a series of actions take place. It's going to rebalance oxygen in your blood. So blood supply is going to increase in the area. The capillaries are going to increase. So all of that with the nutrition is coming in and all of the waste is leaving. So one of the things is hydration. People get an enormous amounts of hydration. How does that look on the skin? It looks like a reduction in fine lines and wrinkles. Think of a raisin and a grape. The difference between a raisin and a grape is the water content, right? A raisin is a dehydrated grape. So that's what happens to our skin all over as we age. It shrivels and it shrinks, and we can fortunately delay that process. And CO2 Lift Gel is very effective at doing it. So you would use it for your skin for anti-aging because it helps to repair or regenerate the skin so quickly after a procedure, whether you're doing some type of laser, microneedling, energy-based device. You would use it to speed up healing. Or if you were to do plastic surgery, you got a tummy tuck or lipo, the inflammation and swelling that results, we would reduce that very quickly or avoid that and reduce the healing. Then, because of that, no, one of the things CO2 Lift does very effectively, it can close a non-healing diabetic ulcer. So you think about what the problems with diabetics is circulation. So their blood flow or on their extremities has slowed down, so they don't heal very quickly. That's what made me think it would be great for genitals. Because when I got into my late 40s, I'm in my 50s now, I noticed a difference in the quality of how sex felt. Because what happened when what a gynecologist made me understand is that aging impacts not only your face and your neck and your hands, it affects your genitals. It slows down blood supply, circulation slows down. So just like with a penis, you need, if you slow down the blood supply, you don't get very hard. The same thing happens with a clitoris. We need blood supply. And if it doesn't get enough blood, just like with a penis, having sex with a flaccid penis is not that enjoyable. So many women are having sex with a flaccid clitoris. And so blood supply is important for that, as well as inside the vagina, that tissue is very thin, just like the tissue under our eyes. And so it gets drier, thinner and drier. And so what happens if that's not treated, women eventually leads to painful sex, drier sex. So the CO2 Lift V, which is a different formula from the CO2 Lift regular because of the pH and another thing, basically it thickens that tissue very quickly and increases blood supply. So we have done 3 double-blind clinical studies. And what that means is that the patients don't know if they're receiving the CO2 Lift or fake gel. It's a gel. And then, as well as the investigator doesn't know what they received. The women that got the fake gel showed no change in sexual function. The women that got the CO2 Lift V showed significant improvement in orgasm, lubrication, sustained lubrication, as well as arousal, as well as a decrease in improvement in bladder life, so stress incontinence.
So
right?
Two questions. So when you say now I don't know if you said significantly increase, like the I guess my question is a time frame, right?
Yes.
Is that subjective depending on each person, or are you talking like from weeks to days? Like, is it that dramatic?
Yes. So great question, because it's not a lube. So this is not a lube that you need to use before sex, or it's not like Viagra that you would take before sex. This basically is a treatment that fixes the problem. So women notice a difference within the first 3 treatments, depending on their symptoms, and well as their partner will notice. I'll use a man just to give you an idea. So urologists have done studies with men, right, for erectile enhancement. They've used 5 in a row. A man will use 5, put it on his erectile tissue, and then what he's noticing is an improvement in erections. If they used a SHIM score, which is a sexual health index for men, and it improved that 5 to 12 points, which that means if a man was experiencing mild to moderate ED, after the 5 treatments, he no longer was experiencing those issues. And he wouldn't have to repeat that treatment for 6 months. So it's long lasting, right? So whenever he's thinking about it, it would improve his erections. Well, for a woman, it's very similar. Once she's done 5 to 10, now it's changed her blood flow. It's changed the tissue. In fact, when we look at the tissue with a biopsies, when we do biopsies on that tissue, you can see that tissue is thicker and healthier. So for a woman, after she does 10 within 2 weeks, the functionality of her vulva and vagina has gone back 10, 15 years. And she's able to enjoy more comfortable sex and enjoy that. And that will last. Then she can maintain that by doing a monthly treatment. Does that
Okay,
answer?
so I have 2 questions.
Yeah.
So for the women, so you said it's up 10 treatments, right? 10 to 15 treatments within how many weeks? I'm sorry.
Yes, 5 to 10 treatments
2
within
weeks?
2
5 to
weeks.
10
Yes.
within 2 weeks. You use a comparison between a raisin and a grape, right?
Yes.
Does it have the actual appearance change?
Okay. That was the cherry on top. Yes. She's going to have, it's going to, her vulva is
We intended.
burst the cherry. Yeah. That the vulva will look nicer. It gives a nicer look to that and the feeling. But I think more importantly, the functionality
It's
will
the
change.
feel. Yeah.
Yes. Feel of
Yeah.
it.
And then during the treatment, is it okay for the person to be active?
Yes.
Sexually
You can,
active.
yes, you can actually, some people have sex with it in. So it's basically a gel. It's mixed. It's applied similar to a tampon. So you pull up the gel, insert it inside the vagina, 3/4 of it, and the rest of it goes on the vulva and to the perineum. You would put on a panty liner and go to bed. But the time period that that treatment is actually lasting is an hour. Even though you can sleep in it, it's really only effective because after the hour, the CO2 is out of the gel. So if you wanted to have sex, there are people who have sex with it in, but there's no downtime. In other words, if you remove the treatment, the next morning you pee it out, you can have sex right away. There's no downtime for it.
Okay.
There's no pain. It's a very cooling gel that you're applying. So it's a very comfortable treatment and there's no pain with it. Sorry?
Yeah. Can you see me? Can you see us?
Yeah. I can see you.
And what is do you have your Wi-Fi on? What is the ratio of men to women doing the actual procedures?
Well, our focus is on women. We have a CO2 Lift V, which is specifically for women because of the pH of the product. But there are many men who are using it. A lot of men too, when I look at a lot of the physicians who are focused, even with men who are looking at penis enhancement. I mean, there are people who can do penis enlargement. They're putting fillers inside the penis to make you, so you can get more girth and even length. They're doing things where you can get it's called scrotox to give you longer erections. So whenever you do any type of injections down there, they're using the CO2 lift. Or if you're using platelets for the penis, which they call PRP treatments, or like the P shot, they're using the CO2 lift because you still need circulation. Usually a lot of those treatments, you should be using a penis pump, which is supposed to bring circulation. Instead, they're using the CO2 lift. But for men are using it as well. However, our focus has been primarily in the sexual wellness area for women because we have very few options. And in fact, many women didn't even understand the impact of aging to their sexual life, that there is some that's treatable, that you can do something about it. And so that's why our focus has been in really educating women what happens and showing them a solution.
Is there a specific age or does it matter how much usage the vagina has gotten throughout the years? Like, is there, should a 22-year-old entertain this, or is it more 50 plus?
Great question. So aging, you talk about, many people look at, say, other nations or other nationalities that take a longer to age. Let's just you can use black skin or you can use Asian skin. Our skin is thicker, right? But one of the things with, let's say, Asian skin, people always say, oh, they never age. That's not true. Only to those who start taking care of their skin early. As generally, they start their skincare from their around 15 years old. So it's going to freeze. There is almost like freezes or delays that process. So if you start early, it delays it. typically in the United States, we don't start till later on. Things are changing. I think with TikTok, so many younger people are starting earlier to take better care of their skin. Well, the vulva and the vagina is another body part that aging starts at 25. That's generally when aging starts, circulation starts to slow down. So I would say if I had a daughter, and I have 2 boys, but if I had a daughter, I would want her to start in her 20s to start taking care of that. She may not need 10, but to start keeping her blood flow, keeping circulation going down there is only going to help her. In fact, there's some gynecologists who use this to help women who are trying to have children, who are using it for people who have painful periods, because really it's blood flow to that area. So we're trying to slow down aging down there, keep everything heightened, our sensitivity heightened. So I would say, in your 20s, you want to start taking for the CO2 Lift, definitely start. My children, well, I guess they're not children. My boys started using the CO2 Lift face from they're like 15. They started taking care of their skin, and they're boys, but I think younger people are starting younger. Yeah. But again, it would be the same thing for the vulva vagina. I would say if I was telling a younger person, if I was to go back in time and we had this, I would start using it in my 20s.
Wow. Now, have you seen side effects in the sense of like a person, like some women have reactions to, well, some people, men and women, have reactions to latex, right? Just for an example, have you seen side effects of people breaking out, or is it?
No, because it's CO2 gas. And so everyone has it in their system, right? So they're using it on the most sensitive skin. They're using it right in the OR right on open skin. So the gynecologists will use the V right when a woman gives birth, right? Even the week before she gives birth, they start using it in order to prevent tearing. So just elasticity on there. And if she did happen to get an episiotomy or she did tear, they can use it right on that tear to help that to heal.
Right.
Interesting. Can you explain clitoral atrophy? Am I pronouncing it correctly? Atrophy?
Atrophy? Yeah, well, so atrophy is when something starts to shrink in size, right? With just no use. So people maybe be familiar with muscle atrophy. If you don't use a part, it starts to die. Well, that's the same thing can happen to the clitoris with lack of blood flow, because the clitoris needs blood flow to operate optimally. So when blood flow starts to slow down, eventually the clitoris starts to get smaller or shrink or atrophy. So again, what can you do to prevent it? Something that involves blood flow. What are the alternatives that are there? Well, I mean, obviously the CO2 Lift is very effective. It's something you can do in the privacy of your home, but there are other things that you can use. You would have more invasive procedures. Like you would do, women may opt to do laser or some type of energy-based device inside the inside of the vaginal walls to control damage to the tissue to elicit a healing response. The CO2 Lift is doing that without having to damage the tissue.
Wow. Wow. Did you have a?
Go ahead.
So can a person use, because I think you mentioned it earlier, can a person that is undergoing vaginal rejuvenation use this in conjunction with?
I think, well,
right.
Because it's two separate things.
Well, vaginal rejuvenation is a big word that they use. Originally, that was just meant for people who are doing surgery. You think of surgery like a vaginoplasty to the walls. Then it extended to using energy-based devices to do it. Now, CO2 Lift is considered vaginal restoration. That people don't like using the word rejuvenation, but vaginal restoration. So it's just another tool to do the same thing.
Okay.
The only thing less invasive, right? Because what are the three that I always think of, maybe 4 areas to a good vaginal health, right? We want to have the tissue healthy. That way you're going to lubricate. You're going to have healthy pH. So you're going to have less infections, right? That's one aspect. Then the other one is the vaginal tissue. You want it thick. So that's why Women who have started getting thinner, and they start using, say, the CO2 Lift, and it tightens. It feels like it's tighter because the tissue is just thicker. So it feels like it's tight, but it's just thicker walls. The other thing is blood flow, because you want your clitoris, which is your pleasure center, to operate optimally. And then the fourth thing would be the muscle, which we really can't do anything from the CO2 Lift V point of view for the muscle. That has to be surgically done. So you need a vaginoplasty to tighten the muscle inside.
What would you say to a person that, what would you say to a person that is very, very, I'll use these adjectives just randomly, shy, prude, very sensitive when it comes to any discussion of stuff down there, right? They believe it should be very, it's the way God made it. I don't want to do anything to it. What would you say to that person that just has these thoughts about any sort of care when it comes to that?
Yeah. And I've heard that before. I would say, are they taking vitamins right now? God made us with just to eat food, right? Vitamins are man-made, but we're doing it because we find that our nutrition, or the food that we have, is depleted of a lot of nutrition. So we have to supplement. Or if you talk about what they use on their skin, why use sunscreen? Why use a moisturizer? We weren't created with any of that. Our skin should just replenish itself, right? But it doesn't. I think as technology improves, we can find things to help us to preserve youthful functionality and our looks, or how the way we feel. And this is just another thing. And I think prior to, where women are at today is where men were at 25 years ago. 25 years ago, if you said to a man, you can get harder erections that last longer, they'd be like, I'm good, because there was no solution. But then when the advent of the blue pill, or whatever color it is, then now you have a solution. So for women, we're in the same. Aging does affect us down there, and this has impacted our quality of life big time. That's why it has contributed to a lot of divorce, because women, if once this happens and they lose sensitivity down there, or it's painful, they're not going to want to have sex. And that's a way that connects you to not only yourself, to your partner. And it has affected women in their relationship with themselves and their partner. So we now are providing a solution to this problem. We're living longer. We should have better quality of life as we continue to live longer.
So I have a question that is kind of, it's definitely related, but I guess what I want to know is, there seems to be some major craze right now with a lot of women. Leave it alone.
I'm poking something
with
over
a lot
here.
With a lot of women utilizing inserting boric acid into their vagina.
Boric.
Their is a capsule.
Yeah.
Does that alter? I know typically it's to kind of level out their pH, right?
Yeah. It's helpful. They're using it particularly for BV. Yes. And I don't think it's something new. I mean, it's gone I remember 20 years ago, people were using boric acid. It's just not, yeah.
Well, maybe it's just, maybe not new, but more so it's recirculating, right? Because I'm just now hearing about it now. I've been hearing about it for maybe like the past 2 years. People, more and more people are talking about it and utilizing it.
Okay.
Does that have a long-lasting effect on your vaginals?
The boric acid?
The boric acid.
The boric acid, so they use it, some people would use it, for instance, if they are getting constant or recurring BV infections, or they would constantly have to use it, or they would use it, for instance, after sex, because the pH of semen can throw it off, and then they'll put it on after sex. I mean, I've used boric acid in the past. I haven't had to use it in years. And I find that, I think one of the things with the CO2 Lift V is that because it balances your pH, you're going to not get as many infections. So you're going to stave that off. But in terms of the if long-lasting effects of boric acid, I think whenever you have an infection, that's when you would use the boric acid for those who are using it. Yeah.
Because I would say, like, what I've been seeing or reading that people are doing, they're using it, right after a menstrual cycle,
Or
right?
that, yeah.
But I just was curious to know whether or not, one, clearly see the CO2 lift is an alternative, but whether or not, and probably a better product to use, but whether or not just the acidity of or whatever it is, I don't even know the makeup of it, but whatever the boric acid is, does it have a negative effect possibly?
I don't think it has a negative. I mean, some people will just say, I wouldn't use boric acid there. Because some people use it for rat poison. I mean, it's used for different, right? So, right. I mean, but the CO2 Lift V, I would definitely, I mean, obviously it sounds self-serving. I would definitely recommend that as a better option. Some women do use it right after their periods to kind of restabilize it. They do use it after sex. I mean, people are using it to just rebalance their pH. And it's doing more than that too. Remember, because it's actually giving blood flow, it's giving nutrition, it's giving all of that to that area, which is all good for us.
Right.
And let me ask you, because there was an interview you did, and I don't remember the exact thing, but I just remember this buzzword. You said it's like butter.
Oh, yeah. Well, my mother who used, when we were starting off with the CO2 Lift V, she said she went from sandpaper to butter. Oh. So that's how painful it was for her having sex. Wow. And then and that's generally what women can look forward to. It's going to happen because when we lose estrogen, that tissue gets thinner. It does become drier and more painful. So it happens for women at different ages. But can you imagine sandpaper down there? That's not a comfortable situation. So basically what it did is just rebuild her tissue and blood and just kind of lubricated that area so that it was just nicer for her, more comfortable and more pleasurable for her.
Wow. Yeah. It's like, I remember the butter line. I remember.
Yes.
And so I wanted to just make sure we put out there also. So it's silicone free, it's paraben free, and it's cruelty free, right? So you haven't tested on animals, because I know that that's a big thing for a lot of people also.
Correct. Yes.
Okay. Because that's one of those things where people ask, and I'm like, I don't know.
Yeah, but it's important for some. Yeah, we don't, and it's again, what is the mechanism of action? It's just a natural thing that we have. It's CO2 gas that everyone utilizes. We breathe in oxygen and we exhale CO2. So it's just what really we're doing is putting our bodies in a position to be able to quickly heal itself.
I love that. It's almost like Wolverine.
Kind of, I guess.
Because Wolverine, like, he heals himself, like he heals at like a magnificent rate, or whatever you would say, speed. And so that's part of the that's so okay, so let me ask, do you have dermatologists so we are in Boston. Do you have dermatologists that are in Massachusetts that you work with?
Yes, of course. If they go to our Lumisque website, and Lumisque is the provider website. Lumisque.com, you look in providers and put in your zip code, you'll see providers in your area. But yeah, we have in Boston some with the V. We have plastic surgeons who use it. We have med spas that use it. Yeah.
Okay. And you have what is the without the exact amount, obviously, because it ranges with providers and their fees and different things like that. But if a person is just considering this, is there a range that they can expect? Because obviously it's not $50, but that doesn't mean it's 50,000 either.
Right. No, for a treatment of 10, you can get it for about $1,000 to get a remodeled vulva vagina. Versus what is the competition? to get an energy-based device that will do the same thing, you're going to pay about $2,500 to $3,000.
Wow. That's a deal, man.
And so
Yeah.
for the 10 pack, this is not you necessarily going into a dermatology office, or this is you purchasing and getting it direct, or
Yeah, but they can, yes, because the CO2 Lift V is the same one that they sell at the doctor's office, the one that you're on our site. The CO2 Lift is different. The Pro is only sold through a provider. So the Pro is that it's just a little more concentrated and it has other things for brightening in the skin. But the CO2 Lift V is the same one. So if you look on the site, I think it's like what, $550 for a pack of 5, or $600 for the 5. So they'll be buying both. I think a lot of providers have even discount that figure for providers. So it's around, again, for 10, and then they have different packaging that they sell in the doctor's office. So you're looking at about, $1,200, $1,000 to $1,200 to remodel your ride.
Did you say your ride?
Yeah. Yeah.
I love it. I love it. So I had a couple of but I feel like I've been taking up all the.
I mean, it's fine.
I mean, typically she's, talking all the time, and I gotta like mute her mic or something. But I think, she's allowing me the space because I'm fascinated by this for a million reasons. And my mind is going a million different places, and I'm being very intentional and conscious to keep it clean and nice.
Okay.
But when we get off the phone,
congratulations.
Yeah, I got a bunch of things to say. So let me ask you, for a person that is, because there are some people out there, and there's a population that are very surgery heavy, right? So it's Botox, and it's the Restylane, and it's the lasers, and it's more, right? Do you feel this product speaks to that person? Because it's I don't even know if that question makes the most sense, but I think for a person that wants immediate results now, what they can look at, does this speak to them, or is it like a completely different audience?
No, it does, because even if you're doing any kind of injectables, fillers, any of the things you described, tox, I mean, that's not addressing the quality of the skin. So even if you opt for surgery, it's still not addressing the quality of skin. So that's why surgeons use this not only to help to heal and to reduce swelling after a procedure, but actually to help the elasticity of the skin, to help back the microbiome, to bring back skin health is what the CO2 Lift is very good at. So it's another aspect altogether. So fillers or tox will help with wrinkles and fine lines. Even if you're doing things like biostimulators that are naturally going to help to rebuild collagen, the CO2 Lift is used by many injectors prior to help prepare the cells to be able to do what you want to do, or even after, to reduce any of the swelling that you may get from that procedure, as well as to help to extend the telomeres, to bring skin health back. So the CO2 Lift is going to be effective for people who are into injectables or people who are not, because it's about skin quality.
So you mentioned earlier that the CO2V Lift is good for also good for individuals who are trying to conceive. Can you speak a little bit more about that?
Well, we haven't done any clinicals on that. I'm just giving examples or testimony from gynecologists who are using it. For instance, we had one that there was a patient who had been trying. They had several embryos that were that were put inside of their womb, and they weren't able to carry it. They lost the baby. Yeah. So what they eventually did, they stopped trying, started using the CO2 Lift V, and then the person got pregnant and was able to sustain the pregnancy. So we've had cases like that, but we haven't. I mean, how do you do a clinical to prove? The theory behind it is that you're improving blood flow, oxygenating the tissue. So you're going to have a healthier tissue down there.
Got it.
thought you was gonna steal my question. All right, good. Because I was about to be really annoyed.
go.
All right, so you mentioned periods, and there was something I wanted to ask you, healing modalities for menopausal symptoms, right? Can you speak a little bit to that? Because I think that that's major, because there are some women in my life that have really heavy cycles, and it's a really like hard time. So like how can you address that?
So what menopausal symptoms are you speaking of specifically?
So I think if it's well, I guess that's two different things. That's two different things. So menopausal symptoms,
I think you're just more so referring to menstrual.
Menstrual, yeah. I think in my mind, yeah. So what menstrual cycles, does it impact like long term, possibly like the experience and the flow of that, or is that a completely separate?
The cramping, he's, I guess, more so referring to the cramping and the heavy blood flow.
So I haven't had my period in a while, so I don't count. But even then, I've been perimenopausal. I mean, I'm in my mid-50s, but I can tell you that people who have expressed, using it for painful periods and getting relief. Again, we have no clinicals to support that.
Yeah.
What we know is healthier tissue. So it makes sense that it would, but that's not the indication for this. The indication for this really is pushing back the age of that area, the functionality, increasing the lubrication. Remember when you're young, you would have to wear panty liner because you would have something on your underwear because that's how wet you were. It's as you get older, that doesn't happen. Well, once you start using the CO2 Lift, you actually get back to that. So this is more on the tissue health. This is more on the tissue thickness and blood flow.
So are you saying right now that I'm going to have to start buying Leah diapers and panty liners?
I wouldn't say the diapers, not diapers. But yeah, I mean, I definitely have experienced that personally and heard a lot of women who expressed that as well.
And so I want to also just speak to, because it's fascinating. Before going into this call, I was thinking strictly women, but for you to say that men also can use this and benefit, can you just speak to, so we spoke to maybe from the woman's perspective, but a man that is thinking about doing something to improve and doesn't want to use a penis pump, doesn't want to undergo surgery.
Yeah. So right. A man who is experiencing minor ED issues.
Minor and moderate, right? Can it be moderate?
Well, yeah, it's moderate. Yeah, they'll be able to use, I mean, from what we've seen, they'll do 5 in a row and they'll see an improvement in that. Also the quality of the skin too, but definitely the functionality.
Wow.
Because remember, it's, too, you feel more sensitive down there because again, it's blood flow. So what we have, if you go onto the Lumisque website, there's actually a webinar on firmer, stronger, harder, or something like that. And you can actually hear from the physician what they're doing for their patients, their male patients, and you can see them actually apply the CO2 Lift to that area. And you can hear, and then they interview the same gentleman 3 weeks later, and he expressed that he was more sensitive, he could last longer, he just enjoyed sex better.
Well, wait a minute. That's kind of like
sensitive,
but that could be an oxymoron, no? Like the more sensitive you explode.
Well, not necessarily. I mean, you just enjoy it better.
Yeah.
Right? Doesn't necessarily mean that you are going to climax faster. Mm-hmm. Possibility, but it's not necessary.
I'm intrigued.
So you talk about the application. So you're saying the men will do it 5 in a row. Are you saying like for 5 nights out of a week, for 5 consecutive nights they would apply it?
Correct.
Oh.
Okay. And again, so for them, maybe after an hour after the application, are they able to?
They can take it off. They can wash it off. It peels off.
Oh.
Peels off like skin.
Like a mask.
like gel, so it peels off that way, and then they can have sex right away.
And then for the women, how does that come out of them? Other than, do
When
they
they
have to
when they
urinate it?
yes, when they urinate, it falls out like semen in the toilet.
Oh, great.
Interesting.
Okay.
I'm intrigued, man. Okay. All right. So as we're coming up on time, did you have final
Yeah, I think I want to just reiterate that for the women, it's the 5 to 10 treatments,
Yes.
consecutive treatments.
Within a
Okay.
2-week period. So if it was a 10 treatment, they could skip the weekend if they wanted to, or just do it straight through.
I see.
Yeah, but within 2 weeks, you want to complete the 10.
The 10. And then to keep it up or follow up, how soon after that 10 treatment, that 2-week treatment, do they need to reapply, or should they reapply?
The next month, once a month.
So it should be something that they do once a month.
One application a month.
One application a month.
So this is the ongoing maintenance, but in the initial, you're pretty much shocking or training the body.
Right.
And then you're just doing the once a month maintenance.
Right. It's called the loading dose. And then after that, you do once a month to maintain. Suppose she didn't do it once a month. I mean, some women don't do it once a month, and they still, they'll do it once every other month. You'll kind of see for yourself how it is.
But the idea is to not set it and forget it. You have to it's a tune up for your hoo-ha.
Right. It's a tune up. Just like you would do something great for your face, we're doing something for our vulva.
I like that.
Me too.
I want to do something good for your vulva.
I think you should.
So on that note, we came up with something for the listeners, and so there is a special coupon code, a discount code.
Yes.
And if you go to Lumisque and put in, is it WEDLock 10?
WEDLock 10. So they would have to go to CO2Lift.com.
CO2Lift.com. Okay.
Once they put anything in their cart, when they're checking out, they would go to WEDLocked 10 for 10% off of the site.
I love that. Okay.
All right.
Okay. So do you have any final thoughts that you want to mention? Is there anything that we haven't covered that you definitely think is important for people to know? Are you making any appearances soon? Are you going to be on the Today Show anytime soon?
We're doing a whole big marketing blitz next year on focus on the CO2 Lift. We were on in Times Square, the billboard in Times Square, talking about with the CO2 Lift. I think you mentioned. I think we covered everything, but I just want to encourage women to consider doing this for themselves. I think with women, we kind of just ignore that area of our bodies, and we just say, like pretty much what you had said earlier, that we'll just wait and see. Nothing's wrong with it now. But why not improve it? Why not prevent something that's inevitable from coming? And the way to do that is by taking care of that area. And there are tools that are available now. And the CO2 Lift is great because it's something that you can do in the privacy of your home. And you're in perfect control over it. There's no pain involved. And it's not expensive. So that is something that if you started younger, you wouldn't even have to do more than 3 as a loading dose, and then just monthly or every so often. And then you could have a young vulva vagina indefinitely. If you wait till you start experiencing the symptoms, you're going to have to do a loading dose, and then you maintain it with monthly treatments. But I would just encourage women to think about that area, especially if they're in a relationship, because this is a big part of keeping the relationship together.
Mm-hmm.
Indeed.
Yeah. If sex is very important to you, and I think for some people that's
very important.
The connection, the intimacy of having intercourse is very important. But now I just forgot what I was gonna say.
Because you're thinking about intimacy.
Yeah, maybe.
Don't worry about it. Look, as soon as we get off this call. So we want to thank you for joining us and talking to our good folks, and we're very appreciative. I think that, again, there's so much information out there, and there's a
Right.
lot of misinformation.
Mm-hmm.
And we just love when people who are experts in that space can actually articulate what it is that they are doing and they're providing, right? And so, thank you so much. We appreciate it.
Oh, thank you. Thanks for having me on the show. And I wish all your listeners, if they have any questions, they can always DM us at
Okay.
CO2 Lift on Instagram, or my personal Instagram at the Lana Kerr.
Okay.
Okay.
So we're wrapping, right? So you're going to do your signature WEDLocked and loaded?
No.
Okay. Well, all right. So thank you everyone for tuning in, and we will be back next week. You know what it is, WEDLocked and loaded. Yeah.
Thank you.
WEDLocked and loaded. Wedlocked and loaded.